It's never really too late. When someone says it's hopeless, it never really is. Here's a compelling story of a lady doctor and how lasers turned her life around.
An ounce of prevention is worth a pound of cure. This is an adage which a diagnostic clinic on Ortigas takes ever so seriously. Integrated laser and complementary medicine uses the most modern, non-invasive, objective, accurate, and radiation-free diagnostic procedures to determine the imbalances in your health before it leads to serious disease. By determining the real status of one's health, the clinic can help establish balance and put one back into a healthy state through one or a combination of such treatments. By boosting one's immune system, these procedures are an effective step towards warding or resolving of some of the most dreaded diseases, including cancer.
Doctora, tell us something about the history of the clinic.
Okay, the owners of the clinic are Mr. Romel Santos and Dr. Bernadette Santos, dentist. And Mr. Romel had training in IV laser therapy in Russia a few years back. And when he was convinced about the benefits that it's gonna give patients, he decided to take it to Cebu, where he grew up. And then with Dr. Ardel Benoya, they noticed that several or numerous patients responded positively.
When you say
therapy.
respond positively, in what sense?
Say about more than 90% improved a lot. And there were several patients who were actually scheduled for operations like bypass,
Yes.
but they didn't have to undergo the operation anymore. They improved
That is really great news.
symptomatically and through the diagnostic procedures that were done to them. So after a few years, about 3 years, Mr. Romel decided to bring the technology here in Metro Manila. So by the second quarter of this year, this clinic came to be.
And you cater to so many different kinds of patients with so many different kinds of health challenges, am I correct?
Yes.
What are the benefits of these?
I actually practice integrated medicine. That's why I offer a lot of services, because earlier I trained in the fields of dermatology, cosmetic surgery, and geriatric medicine. And when I got sick, and so I hopped from one hospital to another, but I got worse. And at the end of the day, when I was advised several surgical procedures, chemotherapy and radiation, I decided to look the other way. So I decided to try alternative medicine. I took a diploma course in alternative medicine and acupuncture. So, but the other doctors here, they are specialists, say, for instance, in cardiology, like Dr. Delphine. So we offer different types of services here.
So what kind of therapy did you undergo to combat your condition?
When I was managing myself already, I had the
Being a doctor?
Yeah.
Yes.
I resorted to a combination of therapies. So there was gallbladder flush, but instead of taking the usual prescriptive drugs, I took supplements. And then I listened to my body, which one is giving me or increasing my immune system or supporting my immune system. I also underwent laser therapy, ozone therapy, and other therapies. And by the end of the 3rd month, I was in a productive state, because earlier, like, I lost about 14 to 15 pounds in 2 weeks. I could hardly stand up, and I was practically crawling to my laptop when I was doing my research to manage my case.
So the success stories you've had here in the clinic, could you mention some of them?
Well,
apart from yourself.
I have several CA patients also, and some CVA, cerebrovascular accident patients, or what we term stroke, brain stroke. Initially, the patients' relatives would complain that they seem to be like vegetables. They had to be assisted even in standing. And I understand that because I went through that stage. But like after the 8th to 10th session of the laser therapy, the relatives will still complain, but in a positive light. Like they will say, na, before he would just give the money for payment of bills, but now the patient has to compute first at that age, okay? Or sometimes he would even go out of the house in the middle of the night because the patient was already courting somebody at that age. So
Life goes on.
yeah, so I was just telling them, no, well, that's a positive complaint, so it's okay.